It's now the bottom of the hour. That means it's time to go in-depth on this Wednesday. And today, we're going to talk about an autism treatment that is now required to be covered by Medicaid in Florida. It's called ABA, which stands for Applied Behavioral Analysis. State officials had refused to cover that treatment, but just last week, a federal judge ruled it must be covered by Medicaid. That ruling stemmed from 3 lawsuits that were filed in the Miami area. An estimated 8,500 kids are covered by Medicaid suffering from some type of autism or related disorder. Now, proponents of that treatment say it's proven to be highly effective in treating autism. ABA is a type of behavioral therapy that helps those with autism develop relationships with others and learn specific social skills. And joining me right now is Kelley Prince, the owner of Behavioral Consulting of Tampa Bay. Kelley, you've been on our program before. Thank you so much for joining us.
Thank you.
Okay, this is a very interesting case because, as we know, autism is a very complicated behavioral problem that isn't just one specific problem. So let's start from the beginning. What does this treatment called Applied Behavioral Analysis involve?
Applied behavior analysis, it's the science of human behavior. So it involves manipulating the environmental variables to improve behavior. So for example, if a child is engaging in a problem behavior, we make some changes to the environment and to the people that are in the child's environment in order to reduce that problem behavior.
Okay, so the first question is, how long has this been around? Is this something that's brand new, so experimental that none of us have heard about it?
No, absolutely not. Applied behavior analysis has been around for a very long time, but there's over 30 years of research as it applies to autism treatment, showing that it's effective.
Now, is it because it's autism that this stickler from the state said that they weren't going to pay for it?
You know, unfortunately, we don't really have all of those answers, but we do know that applied behavior analysis through research is the most effective treatment for children with a diagnosis of autism.
Okay, explain a little more in detail about what it is you exactly do, because we've seen some video of these kids around.
Okay, well, when we have a child come into our clinic for therapy, we do an initial assessment. So we look at all of their skill areas, and the biggest delay that most of our kids have is language and communication.
Right, yeah.
If a child's delayed in those areas, then typically they engage in problem behavior in order to get their needs and their wants met. So we do a full assessment to determine all of the areas of language that they're delayed in, and then we set up a program and we teach those skills in a one-to-one setting using behavioral principles.
Now, if you didn't use behavioral principles, what would you be using?
You know, there's different types of interventions, speech therapy, there's occupational therapy, so there's other interventions that children are receiving, and it's just different from applied behavior analysis in the fact that they don't necessarily look to environmental variables to change behavior. So we look at the child's motivation, we find out, okay, they're interested in this, how can we use this item to get the child to communicate appropriately. So we teach them to request things vocally, or if they don't have vocal skills, we teach them to use sign language. So we just use motivation, and I don't think that's used in other treatments. Now,
have you had any of your clients who have been turned down for Medicaid as a result of this?
We get calls every single day with families that have Medicaid, and, unfortunately, we just cannot provide services to them.
Because they don't cover this particular kind of treatment.
Medicaid has never covered applied behavior analysis.
Okay, so it went to a federal judge, and this federal judge, I don't have the ruling in front of me, but basically said, hey, this isn't experimental, this works, go ahead and pay for it. Not only go ahead and pay for it, you must pay for it.
Absolutely, and so now what we're trying to do is we've been in contact with Medicaid to determine how do we become a provider to provide services to people in the area that have this diagnosis.
It is unfortunate that autism has taken so long to rise to the level where enough people are concerned about it that they say, this isn't just an oddity, this isn't something that's going to go away when they grow up, this is something that needs to be treated and needs to be treated as soon as possible.
Right, and from what all the research shows is the earlier that the child comes in for intervention, the more successful that child's going to be. So it does make sense to spend a little bit more money on the front end rather than having to pay for long-term extended care for the children on the back end who don't receive intensive therapy.
Now, how well does it work? Because I think sometimes, and I'm thinking it shouldn't apply to the same, but a lot of cancer treatments are considered to be, in quotes, experimental because they say the database isn't big enough to prove that it really works. How much of a database is there, and is it a definitive database that says there's no doubt in mind that it's this analysis that has made the change in this child with autism?
Right, and some of the research, there was research that's conducted, and then what they'll do is they'll look at those children several years later to determine if the outcomes are still the same, and it shows consistently that this therapy is proven to be effective for children. Now, as far as the effectiveness, the rate of the effectiveness, it really depends on the child. There's children with just varying degrees of autism, so it depends on how early the child is brought in for therapy, the number of hours of therapy that they receive, and of course the severity of the autism, just to determine what the prognosis is.
You know, and let's be honest about this. It's not just Medicaid. I mean, for years, insurance companies have kind of backed off that and go, I don't know if we're going to cover it.
Right, and you know, there was Florida legislation that was passed a few years ago, and it does require that insurance companies cover the cost of autism services. But there's still a lot of rules and regulations associated with that, so I would say probably 75 of our clients are receiving insurance coverage, but there are a lot of families that unfortunately are still not able to.
Now, since we were unable to get a spokesperson to give us anything but a statement, where does this, when you ask the state, what are we supposed to do? What have they said to you?
We just had some calls out. We haven't necessarily made contact with anyone.
Because this just happened just last week, so I mean, it's fairly new.
Right, absolutely.
What do you say for parents that have kids that are autistic? Because again, my daughter is involved in the school system and working with autism. And how do you encourage them that they're going to get over these humps, these milestones that come along the way, and that the child can live an absolutely normal, productive life with help?
Right. I mean, we usually just suggest that the parents first of all talk to their pediatrician to get more information, but also do research. I mean, there's so much research available to show what the effective treatments are for autism therapy, and as I said, applied behavior analysis is the most effective. And you know, we've seen great outcomes with a lot of the children that we've worked with based on this therapy.
When you say great outcomes, define that. What does that mean?
We have children that came into our clinic with no language, no ability to communicate, and they're in mainstream school settings. So that's our goal. Our goal is to get the children in very young, teach them all the skills they need to learn, and put them out there in mainstream settings so that they can thrive with their peers.
Now, is this applied behavioral analysis more expensive than the other kind of treatments, one way or another?
It's not more expensive, but the frequency that you have to have applied behavior analysis makes it more expensive. So per hour, certainly it's not more expensive, but most of our kids come in for at least 10 hours a week of therapy.
Oh, 10 hours a week?
At a minimum, yeah.
So maybe that's the reason the state is kind of bucking, or at least
right,
because everybody's in Medicaid and Medicare in particular, everybody's trying to figure out ways of cutting the budget.
Right, and I can understand that, and it also involves a lot of parent involvement. So we do 10 hours a week of therapy. That's still not enough. So we still ask that our parents come in and observe sessions and follow through with those therapy sessions at home. How
long do you think it before everybody in this country looks at this ruling and say, you know what, we have to look at ABA much differently? Everybody.
I mean, I think it'll take, a while for this to filter out to all of the agencies that need to have this information. But, now that the state is aware that this is an effective treatment, that all children that have this diagnosis will be able to have the same types of interventions as families that have more money.
All right, Kelley Prince from Behavioral Consulting at Tampa Bay. Thank you. Always good talking.